Hey everybody, thanks for tuning in. So today I'm going to reflect on the idea of health as more than a means to an end. So to do that, I'm going to look at some of the readings that I've done this week. I'm also going to reflect on a video that I've seen, and I'm also going to talk a little bit about the class discussion that happened during lecture this week. So when we got to lecture, our professor said, opened up the floor and asked, what is health? And as health promotion students, that's a pretty loaded question because, there are so many different things that come together, intersect, and affect people's health. But I know for me personally, where my mind automatically goes is what would fall under the realm of behavioral health promotion. And these are like the individualistic or modifiable risk factors in people's lives, things like lifestyle behavior, diet, exercise, adequate sleep, adequate hydration, and avoiding harmful behaviors such as smoking. I think my mind goes there because of how visible those things are. You can physically see if someone is engaging in a behavior or not engaging in a behavior. You can see if they're, choosing to eat a healthier diet. You can, see if they're making conscious effort to do those things. And this idea of health promotion and promoting, the individual lifestyle behavior is really reflected in what health promotion meant or was defined as when the Lalonde report came out. And in this report, there were several factors that were identified, but the one that really was highlighted was lifestyle. And this really took off in public discourse and also with governments and policymakers by putting some onus back on the population and saying, you as an individual can do things to increase your longevity and quality of life, increase your health, and you can also do things that are going to take a burden or a little bit of a burden off of our healthcare system. So these ideas really relate to with the information that people are given. So health education, what to do and what not to do, and what to eat and what not to eat at a very basic level. And this kind of concept was reflected in the video that I saw this week, which was a TED Talks featuring Chef Jamie Oliver. And in the TED Talks, he reflects on childhood obesity and how he believes that the generations before the current generation have really done children a disservice because they brought them into an environment that is not conducive for them to live a healthy life. And this is really brought home when he shows a little clip where he goes to an elementary school and asks kids about what this fruit is, what this vegetable is, and a majority of the students have no idea. They don't know the difference between a tomato and a potato. And what he's saying is that we need to give children and the future of our society healthy living skills, life skills, to teach them and give them the tools so they can live better lives. And this for me really hits home because I agree. I think that that's essential. We should be giving people the information so that they can make these healthier choices or they can live more fulfilling lives. But I also see another side to that, which is if you look at health promotion in a more holistic standpoint, it's not just that. That's not the only thing that needs to happen. Because, again, that's where this idea of victim blaming can come in. We can start putting the onus too much on the individual and saying, you need to do this, you need to do this, you're not doing this, you're not doing this. And in feminist ideology, they want us to move away from that understanding and move towards more of dispersing the onus onto larger influential groups throughout society. So government plays a role, social norms plays a role, the individual plays a role, and saying that altogether these things play a role in health. And again, I agree with this concept too. So this idea of a more holistic understanding and a more dispersed onus for health is reflected in the Alma-Ata Declaration and the Ottawa Charter. Now, in the Ottawa Charter, there were fundamental conditions that were identified as resources needed for health. So these were things like peace, shelter, education, food, income, stable ecosystems, sustainable resources, social justice, and equity. It boiled down to that improvements in health required a secure foundation in all of these basic needs. So as I said before, as I mentioned, education is only one small piece of like 10 things that are required for people to live healthy lives. So if we keep the fundamental resources for health in mind, we can move forward and think about where our healthcare system is going and the role the health promotion will play in developing a system that is based on preventative practices. So to do this, we'll look first at the new public health, which calls for a healthcare system that is built on a synergy between lifestyle-based approaches to care and systems-based approaches to care. And to give a little bit of context of this, I watched a TED Talks by Eric Dishman, which reflects on interdisciplinary care teams. And in the video, he goes on to explain some of the ill health that he's been experiencing over the past couple of years, and how he, as a patient, would really like to see healthcare as what he calls a team sport. And it wasn't that he was blaming doctors and nurses, but he was simply stating that people are unique, and there are unique solutions for every individual. And no one person or one care practitioner can give that solution. So he also reflected then that patients can no longer play a passive role in healthcare either, and they have to want more out of their system and also ask the questions that are appropriate for them to get all those pieces together. So what he's calling for is a personal health system, one that's built on the pillars of care anywhere, care networking, and care customization. Now, this essentially boils down to a multidisciplinary care team that works on what he calls person care and moves people away, or our concept of healthcare away from parts care, which is, specialists only working on this and in isolation from their family doctor, and then their family doctor is working on this aspect of the person's health, and there's poor communication between all parties. And his ideas are directly reflected in what is brought to our attention in the Alma Ata Declaration, which is that environmental and social influences fall outside of the purview of the traditional healthcare system, and this urges us to develop a system that is interdisciplinary in its practice. So moving forward from that information that we just talked about, we can now understand the ideas of relational health promotion and socio-political health promotion. Relational health promotion refers to how people interact with one another, social networks, and social situations, and how they all affect health. And then socio-political health promotion refers to how the government structure or policy or social structures can all affect health. Then these ideas, along with what we talked about at the very start, health education and behavioral health promotion, all come together to make up the full and encompassing idea which is now health promotion, which is reflected in the Ottawa Charter. So keeping in mind the things I've talked about so far, it's really evident where our healthcare system is going. And you can also see the role that health promotion is going to play in that system moving forward. And this is really emphasized in the 5 strategies for promoting health that are outlined in the Ottawa Charter. And these are building healthy public policies, creating supportive environments, strengthening community action, developing personal skills, and reorienting health services. And if you look at it, each of those postulates pulls a little bit on each of the things we've talked about today. And together, they have little chunks that come from each of the types of health promotion: behavioral health promotion, relational health promotion, and socio-political health promotion. And in a roundabout way, that brings me back to the idea that I started the video with, was health is more than a means to an end. And really, that's the take-home message of this video. Health is a resource that helps people to move through their daily environments and get the most out of their lives. Helps them build social networks, helps them build personal skills, helps them to learn more about themselves as an individual and build capacities within their own environment. And that's really all I wanted to take from this. So thank you very much for watching this video. I really appreciate it. I hope you enjoyed it. Check out the TED Talks with Jamie Oliver and the TED Talks with Eric Dishman. I'll put their links in the description box below the video. And that's it for me today. Anyway, I'll talk to you guys after, and I'll see you next week. Bye.